landmarks for the incision are the distal diaphysis of the radius, the medial and lateral styloid processes, the antebrachial carpal joint, the radial carpal bone, and the third metacarpal bone. The foam is incised on the dorsal midline of the carpus to expose the distal 1/3 of the radius, the carpus, and the proximal 1/2 of the metacarpal bones. In a clinical case, the articular cartilage of the middle carpal joint and the carpometacarpal joint is thoroughly removed with a bone curette or high-speed burr, following the contours of the bone surfaces. Additionally, cancellous bone is harvested from the proximal humerus. The graft may be placed within the prepared joints now or added after the plate is secured. A 2.7/3.5 veterinary T-plate is positioned on the dorsal surface of the radial carpal bone and the third metacarpal bone. It is imperative that the plate be placed distal to the articular cartilage of the radial carpal bone to avoid interference with the radius. A 3.5 mm screw is placed through the proximal plate hole into the radial carpal bone. A screw which is slightly shorter than the measured length is selected to avoid interference with palmar soft tissues. The plate position is checked before inserting the second screw. 2.7 mm screws may be used if the radial carpal bone is small. The plate is secured to the third metacarpal, starting with the most distal plate hole. The remaining plate holes are filled.